Well, you probably know these symptoms: severe fatigue, memory loss, extreme joint pain. These may be signs of something more serious. And here to tell us about a debilitating disease that affects millions of Americans is a specialist in infectious diseases, and he's also the director of the Open Medicine Institute. Please welcome Dr. Andreas Kogelnick.
Good to see you.
Hey,
Welcome
doctor.
to the show.
Thank you so much for being here. So tell us about this disease, chronic fatigue syndrome.
Yeah, it's a difficult one because there's not great ways to diagnose it, and we haven't until recently have great ways to treat it either. So it's been a little bit of a medical mystery, so to speak.
Does it tend to get to a fairly advanced stage before it's diagnosed? Is that the problem?
It's pretty variable. Part of the problem is that there's these overlapping symptoms that are very general in context, like you said: fever, joint pain, swelling, lymph nodes, sort of flu-like symptoms that are maybe sort of the worst flu you've had.
Oh my goodness. So, you know, the way you say chronic fatigue syndrome, it just sounds like you're tired, but it's actually much more serious than that.
That's right. I mean, these are symptoms that go on for months and even years at a time. People can be bedridden all the way to, losing their jobs, becoming disabled. And the CDC definition of it is a minimum of 6 months of some of the symptoms that you described.
Minimum of 6 months. So who is most at risk?
Well, that's a great question. The population studies that have been done by the CDC and others haven't really figured that out yet directly, but what we think is that there's some viral triggers that are going around that have been doing this for many years, and that really puts all of us at risk to a certain extent.
So is it like contagious, you think?
There's a factor of that in there, certainly.
Okay. And what about kids? There are some suspicions that kids are diagnosed, but they don't know they have it.
Yeah, we have our age ranges for patients range from about 2 years old all the way up into the 70s. And there's some estimates that are saying that 1 in 500 kids, school-age kids, are out of school and missing school because of this disease.
You mentioned something about the viral strains going around. What do we know what the causes are?
Well, we don't exactly. There's been a lot of implication around some of the various herpes viruses. So Epstein-Barr virus, which causes mononucleosis, herpes 1 and 2, cytomegalovirus, and then a host of other diseases as well, including parvovirus and some bacteria as well.
So is it like all attacking your body at once or something?
Well, the thought is there's some changes in your immune system that are happening either because of these organisms or because of other pathogens that are out there.
Right. Do you think it's preventable?
That's a great question. I don't think we know enough about it yet to really answer it.
But there's no cure?
Well, we've made some strides in terms of treatment with antivirals in the last year or so. So there's a lot of optimism, and we're working hard on getting better diagnostics and different treatments out there.
So these treatments can enhance your quality of life to what degree?
Well, we've taken people from being, as I said, bedridden or wheelchair-bound to being fully functional again, or at least giving them a lot better quality of life.
So the condition is still there, just in either an arrested or an improved state?
I think we've seen a lot of improvement in a lot of patients, and that's a great cause for optimism. The question now is whether we can sustain that over longer and longer periods of time.
Gotcha.
So where are we right now? Are we testing like drugs and things like that?
Right. So we've got some clinical trials that we're teeing up for the fall and into next year with various immune agents and antivirals. And the challenge is figuring out who fits in which category. So there's a lot of variability in terms of who responds to what drug.
So if the symptoms are so generic, I mean generic meaning it could be the flu, it could be you have a virus. How do you know if you have CFS?
Well, what we're looking at is doing sort of more in-depth molecular profiles on these patients, but the average person isn't really going to know except that they're going to be sick for a long time, and it's sort of the flu that doesn't go away is one way of looking at it.
What do you mean, for months? Because flu generally lasts, what, for a couple of weeks?
Yeah. Usually, right?
So months to even years. I mean, our longest patient is sick for 28 years.
Wow.
28 years.
Oh,
my goodness. And that's what you have on record, because there might be others who have been suffering from it for...
Sure.
So let's say you have these symptoms. We shouldn't cause a panic and everybody rush to the hospital, but when should you go to the doctor, or who should you see?
Well, that's a big question. Some doctors don't fully understand the disorder, and so patients get bounced around to lots of doctors. But there's more and more sort of specialists, including infectious disease specialists, who are taking it a little bit more seriously and recognizing it for what it is. So finding a good doctor is a key to that.
Well, you're one of the lead researchers and doctors on this. I know you're treating a very good friend of mine, close friend of mine, and you can find out more at the Open Medicine Institute. We actually have a connection or a link on our website to his website, so you can look for more information about
so much.
chronic fatigue.
Thank you.
Thank you so much. Thank you.